Dr. Neighbor Stevens.
Thank you so much, Dr. Maxey, and good afternoon to everyone. Welcome today to Black Health Trust, and I am really excited to get our program started today because we're going to talk about an issue that is very dear to my heart, and I think after you hear our speaker, it should be dear to your hearts as well. And without further ado, I'm going to turn it back over to our founder, Dr. Randall Maxey.
Thank you so much, Dr. Neighbor Stevens. Hello, Dr. Ivan Walks and Dr. Jocelyn Hines. And welcome to our guest speaker, who I'm going to let Dr. Barbara Neighbor Stevens introduce. But since this is the start of the football season, I have to say her name is Lauren Dungy Parthras. And for those of you who are football fans should get the implication. If you would kindly introduce our most distinguished guest today, who was introduced to us by Dr. Virginia Kane, the newly elected president of the National Medical Association. Dr. Neighbor Stevens.
Thank you. It is my pleasure to introduce our speaker this afternoon. She has such an extensive bio, and I am hard-pressed to figure out what to leave out. But needless to say, she is a graduate of University of Michigan Medical School and University of Cincinnati Fellowship Program in Maternal Fetal Medicine. She has a very distinguished career in advocating for the health and well-being of Black mamas and Black babies. And this is a critical issue. We have touched on it in the past, but the issue hasn't gone away like many issues. And she has spent much of her career advancing that area. She is currently very active in the Indianapolis area, involved in multiple organizations, and has voiced to me directly and has included in her bio that she's very happy to come and share her message with any group that wants to hear and share the information. So without further ado, we will turn it over to our speaker, Dr. Lauren Dungy Parthras.
Thank you. I am going to, I hope, share my screen. Can you see my screen?
We
Yes.
see.
Okay. Sometimes it doesn't work for me. So I am thrilled to be here today. As I said before, I have 2 young Black daughters, and I have spoke to young Black women, and the racial disparities and things that affect young Black women concern me greatly. I recall when I was in my 20s and when I was thinking about getting married, you think about things of who will I marry, how many children will I have? I never once thought, I don't think I'll have children because I could die in a hospital or I could die related to pregnancy. And I've had young Black women voice that to me, and that is very discouraging to me. So I am indeed very happy to speak to any group that would want me to come and speak to them and try and address these issues. And I'm happy to be at this forum, but I like speaking in diverse forums as well. And I say, I'm not here necessarily to make you feel comfortable. I'm sort of here to be a thorn in your side and to raise this issue so that we can improve the outcomes of everybody. So, because if we make it better for Black women and children, we will make it better for everybody. So I am going, I hope this advances. Let me see. Let me try it this way. Okay, so I am talking on implicit biases. And so I want you to imagine that you are in a freezing rainstorm and you come out of that rain, you come into a room, and on the right side, there's a blue fireplace. On the left side, there's a red fireplace. And you have to decide fairly quickly which fireplace you're going to approach because you are freezing cold and you need to make a decision. And you're going to use things in your mind very quickly to make those decisions. You might think, I've never seen a blue fireplace. There's no way I'm going over there. Whoever heard of a blue fireplace? You can't get warm next to blue. It has to be red. There might be several different things. Oh, yes, I have seen a blue fireplace. It was very warm and I'm going to go up there again. But you are going to quickly make decisions in your mind to decide which fireplace you approach. And that's what implicit bias is, the ability to rapidly categorize every person or thing. So I'm just going to make this screen smaller. I'm sorry, apologize. I'm trying to get, there we go. I apologize. So it's the ability to rapidly categorize every person or thing we encounter, and it's thought to be an evolutionary development to ensure survival. Humans in the past needed to quickly decide whether something was friendly or dangerous. And unfortunately, or fortunately, our brains still use these shortcuts, but unfortunately, sometimes we use it to the detriment of others. Implicit bias are attitudes, thoughts, and feelings that exist outside of conscious awareness. And thus, it is very difficult to consciously acknowledge and control these biases. These attitudes are often automatically activated, and they can influence human behavior without our conscious volition. Well, why do we care about implicit bias in healthcare? Implicit attitudes about patients can contribute to disparities in healthcare outcomes. This population that I'm speaking to today, I'm sure very much knows that. There's racial disparities, gender disparities, disability, socioeconomic status, obesity, several attitudes about other things that may contribute to disparities in healthcare outcomes. As professionals, we may often say, oh, we try to treat all patients equally, and we don't believe that we hold any negative attitudes about patients. But by definition, implicit bias or unconscious bias, we lack the awareness of these biases, and our actions often unknowingly suggest that these biases are indeed active. Unfortunately, they can also result from covert discrimination, and institutional bias may then be sustained and accelerated throughout the system and influence behavior and treatment choices. One of the examples that I like to use, that when I was a resident, there was one OB-GYN physician attending who we all liked working with because he always had these nice thin patients. The surgeries were very fun to do. You weren't working on overweight patients. And then I later found out that he had a chair in his waiting room. And if patients couldn't fit in that chair, he wouldn't accept them as a patient. I also read maybe a year ago or so there in Columbus, Georgia, there was a OB-GYN office that said no bonnets. And if you had a bonnet on, you would not be seen as a patient. Now, I will tell you, I'm not a big fan of young women wearing bonnets around on the outside. I know why they wear bonnets. I wear a bonnet at night, but I'm not going to refuse somebody care because they're wearing a bonnet. And sometimes I understand the reasoning of why somebody may prefer to leave a bonnet on as opposed to address what's underneath that bonnet. You see it as pictures in advertising when you go into hospitals. There was a campaign here with billboards and everything, and you didn't see any women of diversity in those billboards or advertisements for healthcare at a certain hospital. And unfortunately, those things can have systemic effects. You probably heard of the implicit aptitude test. It was developed in 1998, and it is a means of calculating how quickly people associate different terms with each other. And if you haven't taken one, I encourage you to just take one to see what it's like. But there's category of pairs that are unconsciously preferred, that are easier to sort than those that are not preferred. For example, they may have pictures of Black and white people with words associated with them, such as good and or bad, into pairs. And based on the reaction times needed to perform those tasks, the software calculates a bias score. Now, people have criticisms of the implicit aptitude test, and there certainly are limitations to the implicit aptitude test, but critics do not refute the existence of unconscious bias or that it can influence life experiences. And according to Project Implicit out of Harvard, the race IAT has been taken more than 4 million times. And 75% of test takers demonstrate an automatic white preference, meaning that most people, including a small group of Black people, automatically associate white people with goodness and Black people with badness.
Someone needs to mute, please.
The extent to which the IAT predicts behavior is unclear, and these preferences don't necessarily mean that an individual expresses outward expressions of negative attitudes or racism, but indeed, these biases do exist. I often show this video, which I'm going to show to you. I like to be in person, and then I ask people, what did you see? And I like to be in diverse groups. When I ask this, I'll let you watch it, and then I'll discuss what the comments that I've had from it. I sure hope it plays. Oh. It is not playing. If you have the opportunity, please look on YouTube. There's the title of this is Racism Explained in 30 Seconds. I will tell you that there is a young Black girl. They're both 6 years old. There's a young white girl, as shown here in this picture. They're on a busy street corner. The Black girl walks up to the street corner and stands there, and they just observe and photograph her as people just persistently walk by her. Nobody stops. Nobody asks her if she needs any assistance. Nobody seems to notice her. She's invisible, essentially. Then immediately afterward, this young white girl walks up, stands in the same place. They are wearing exactly the same white shirt, exactly the same blue jeans, exactly the same shoes. They are both 6 years old. And multiple people stop and ask the white girl if she needs assistance, and seem very concerned by their facial expressions about her and what they can do to help her. When I ask people, what do you see there? The different audiences, I've had some people who didn't recognize the Black girl as a girl, said she was a boy. Some people say, oh, the Black girl looked older. But a lot of people recognize that there was certainly attention given to the young white girl as opposed to the Black girl. This is a study with an experiment that was done at Yale in 2020 with 135 educators who were shown videos of children in a preschool classroom setting. There were groups of 4 students, 2 Black, 2 white, 2 girls, 2 boys. And that these soon-to-be teachers were asked to detect, quote, challenging behavior, unquote. To be clear, no such behavior existed in any of the videos as by design of the research study. Yet, when asked which children required the most attention, 42% of the teachers identified the young Black boy as the most challenging, followed by the Black girl, followed by the white boy, followed by the white girl. And when they did independent results of eye tracking technology to see who these soon-to-be teachers watched, they showed a tendency to more closely observe the Black students, and especially the Black boy, when challenging behaviors are expected. A similar study showed that new teachers mistakenly assume Black students are, quote, angry. They took 72 Black and white child actors trained by experts to make specific facial muscle movements. To be clear, they were absolutely trained to make the very same facial expressions. The teachers in training watched the videos of the children and were asked to identify the emotion they saw. The study showed that teachers are prone to mistakenly see anger where none exists in Black children more than a third of the time. And the research also demonstrated that Black children were viewed as 4 to 5 years older than they truly were. And why does that matter? Well, previously, the researchers had determined that college students who aspire to become teachers were more likely to misread Black adults' emotions as compared to sensing what white adults are feeling, and that they mistakenly believed that Black adults were angry when they were not feeling any anger at all. This current study showed that teachers are prone to mistakenly see that anger where none exists in Black children at the preschool age as well. So it's an issue that starts way early in preschool and is carried out throughout much of the rest of life. And that might explain why Black children are 3 to 4 times more likely to be suspended or expelled from school than their white classmates. And that why Black children tend to feel less understood by their teachers than their white children. And this problem, unfortunately, begins very early before the children even make it to kindergarten. The potential of consequences of poor relationships between students and their teachers and school discipline can be long-term and can last well into adulthood. That might explain why in Orlando, this young Black 6-year-old girl was arrested, handcuffed, and taken to jail for what was described as throwing a tantrum in her kindergarten class. It might explain, unfortunately, why this young 12-year-old Black boy was killed while playing with a toy gun all by himself in a Cleveland park. Teachers are not the only adults who mistakenly see Black children as angry and overreact. And unfortunately, sometimes those consequences are tragic. There, unfortunately, have been example after example after example of dehumanization, devaluation, hate crimes, and racism that are related to these biases. I gave this lecture a couple of years ago, and I just keep adding more pictures, more slides of things that unfortunately are ongoing. There are a lot of factors that affect health. Things like community safety, your employment, housing, transportation, food stability, income, personal and family friend experiences. But there are things such as hate crimes, microaggressions, police brutality, implicit biases, and racism that affect